Jardiance is used with a proper diet and exercise program to control high blood sugar in people with type 2 diabetes. Controlling high blood sugar helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. Active ingredient empagliflozin. Empagliflozin is also used in patients with type 2 diabetes and heart disease to lower the risk of death from the heart attack or stroke. Empagliflozin works by increasing the removal of sugar by your kidneys. Empagliflozin is also used to treat heart failure. It may help your life longer and lower your risk of going to the hospital for heart failure. Empagliflozin works by increasing the removal of sodium by your kidneys. Who can use Jardiance? Jardiance is used for patients aged 10 years and older with type 2 diabetes mellitus to lower blood sugar levels when used with diet and exercise. Adults with heart failure to reduce the risk of cardiovascular death and hospitalization. Adults with type 2 diabetes mellitus and established cardiovascular disease to reduce the risk of cardiovascular death. How to use? Jardiance is a tablet that you take by mouth. Jardiance is usually taken once daily in the morning. You should take it around the same time each day. You may take this medicine with or without food. Your doctor may start you on a low dose of this medicine and increase your dose as needed. Don't take more or less of it or take it more often than prescribed by a doctor. Usual the dose of Jardiance for diabetes type 2. Initial dose 10 mg orally once a day in the morning. Dose increase. Dose may be increased to 25 mg orally once a day for patients tolerating therapy and requiring additional glycemic control. Maximum dose 25 mg per day. Usual the dose for cardiovascular risk reduction. Initial dose 10 mg orally once a day in the morning. Dose increase may increase to 25 mg orally once a day for patients tolerating therapy and requiring additional glycemic control. Maximum dose 25 mg per day. Usual the dose for heart failure with reduced ejection fraction. Dose 10 mg orally once a day. Contraindications. You should not use Jardiance if you are allergic to empagliflozin or any of the inactive tablet ingredients, or if you have severe kidney disease, or if you are on dialysis. To make sure Jardiance is safe for you, tell a doctor if you have ever had liver or kidney disease, have history of blood infections or urination problems, have a history of infections in the genital area, penis or vagina, problems with your pancreas including surgery, alcoholism, or if you are currently drink large amount of alcohol, if you are on a low salt diet, or if you are 65 or older. Jardiance is not approved for use by anyone younger than 18 years old. Jardiance is not treating type 1 diabetes. Warnings. Stop taking Jardiance and call a doctor at once if you have signs of serious side effects such as stomach pain, vomiting, tiredness, or trouble breathing. You should not use Jardiance if you have severe kidney disease or if you are on dialysis or if you have diabetic ketoacidosis. Taking Jardiance can make you dehydrated, which could cause you to feel weak or dizzy, especially when you stand up. Tell a doctor if you are on sick with vomiting or diarrhea, or if you eat or drink less than usual. Jardiance can cause serious infections in the penis or vagina. Get medical help right away if you have burning, itching, odor, discharge, pain, tenderness, redness, or swelling in the genital or rectal area, fever, or if you don't feel well. Jardiance side effects. Get emergency medical help if you have signs of an allergic reaction to Jardiance, hives, trouble swallowing, difficult breathing, swelling of a face, lips, tongue, or throat. Seek medical attention right away if you have signs of a serious genital infection, penis or vagina, burning, itching, odor, discharge, pain, tenderness, redness, or swelling of the genital or rectal area, fever, not feeling well. These symptoms may get worse quickly. Serious Jardiance side effects. Stop taking this medicine and call a doctor at once if you have a lightheaded feeling, like you might pass out, dehydration, dizziness, confusion, feeling very thirsty, less urination, ketoacidosis, too much acid in the blood, nausea, vomiting, stomach pain, confusion, unusual drowsiness or trouble breathing, or signs of a blood infection, pain or burning when you urinate, blood in your urine, pain in pelvis or back. Some side effects may be more likely to occur in older adults.